Women do not always have the typical signs and symptoms associated with heart disease or the things that we see on TV, the jaw, the chest, all of those things. Women are also much more likely to write their symptoms off as I'm feeling anxious or my back hurts. So having those atypical symptoms and then being much more hesitant to seek help are some of the reasons that women can get themselves in trouble.
Welcome to Start a Conversation, where we dive into real estate, community, and more. With over 25 years in the industry, building businesses and community involvement, I believe real estate is about more than transactions. It's about people, stories, and the places we call home. Let's start a conversation. So welcome to Start a Conversation and back to Love Yourself Month. We are so excited today to be here at East Alabama Medical Center with Miss Kate Ruud. She is going to share some invaluable information with us about our health and how we can make it better in the future. Kate, I'd love for you to introduce yourself and tell us a little about what you do here.
My name is Kate Ruud, like you said. I'm the director of critical care here at the hospital. That includes the areas of the intensive care, the cardiac intensive care, our cardiac ORs, and our step-down areas in the hospital, and do everything from kind of managing the personnel to operational and more towards the growth and business side of what we do here at the hospital.
Perfect.
My background is in the cardiac ICU. I was a nurse in that area for about 5 years before becoming a manager of that area, and became a director about 2 weeks before COVID hit our area. So that was a very interesting transition.
Yes. Wow. You got a lot of change and a lot of very fast.
Yes, very fast.
Very exciting. As I mentioned in one of my other videos, we are talking a little bit about Love Yourself Month and how important it is about your heart health. So tell us a little bit about statistics and how this affects our population.
So it's really interesting. So I think most people are aware, or many people are now aware, that heart disease remains the #1 killer in the United States and across the globe. What is really interesting to me is that has remained the same since 1921. So we've been over a century of time where that statistic remains the same despite all of the technology advances in medicine and everything like that. So then you really kind of dig into the question of why that is.
Right.
And there can be very different reasons for it. And a lot of it is things that you've heard before. There's modifiable risk factors and things that are important to your health, exercise, eating right. But those can be very challenging things. There's also things that we don't think about as much when we think about heart health. Sleep is very important.
Sleep.
And stress relief. Managing stress is something that is very important for our cardiac health.
I'm not doing well with that, but we're going to work on it. Kate's going to help me with that. So talk to me about, since 1921, that's huge as far as length of time, but are there different factors as far as like genetics you're seeing or age that you find?
So both. I think that's a really interesting question. So we do have much longer lifespans because of modern technology and things, and that always plays a factor into it. There are things like genetics that are certainly a component, and unfortunately not much that we can do about the genetics. So when we're talking about heart disease, we talk about modifiable and non-modifiable risk factors. Your genetics are your genetics, but there are some things that we can do to manage those. So there are genetic components to things like hypertension or high blood pressure, diabetes, but they are modifiable in the way that we manage them and take care of these things.
I guess so, medicines, prescriptions that can help hopefully regulate some of the genetic things. Is that what you mean by that? Is it?
Yes. So hypertension is something that can run in families, or the high blood pressure. High blood pressure is really dangerous to your heart for a couple of reasons. Our heart works primarily as a pump, but what it services is the rest of our body and those blood vessels. So when our heart isn't working as well as a pump, then we're not feeding all of our important arteries and our organs like we should be.
Right.
So when we're talking about muscles, the heart is a muscle. But when we're talking about muscles, when you talk about working it out, having to pump harder, things like that, that's great for your bicep. Not so great for your heart.
Good point.
The heart will get tougher and it doesn't work as well as a pump. So managing that high blood pressure with things like medications at times, but also things like exercise and diet can also influence that.
So the exercise making it pump harder, very different than the stress or high blood pressure making it work harder.
Correct. When you're talking about stress, you're talking about something that is prolonged. So stressful situations, or many times, many of us are finding ourselves almost in that fight or flight and that stress response all the time
All the
now.
time.
Yeah, what that does is increases your heart rate, increases your blood pressure, increases your cortisol, and all of these things can create increased risk for heart disease.
And then I guess the other part of part B of that question was about age. Have you seen that the age is playing a factor or gender?
It's really interesting with heart disease in women in particular, and I think it's always important when we're talking about Heart Month and taking care of yourself that we really focus in on women. Women do not always have the typical signs and symptoms associated with heart disease or the things that we see on TV, the jaw, the chest, all of those things. Women are also much more likely to write their symptoms off as
Mm.
I'm feeling anxious or my back hurts. So having those atypical symptoms and then being much more hesitant to seek help are some of the reasons that women can get themselves in trouble.
Yes, that's absolutely true. Yeah.
Also with women, it's interesting that things like the time of when you go into menopause, estrogen is very cardiovascularly protective. So the age of menopause is also putting women at higher risk. Also things like when gestational diabetes in pregnancy and hypertension during pregnancy can also put you at long-term risk for cardiovascular health issues as a woman.
Okay. Wow, that's interesting. I love that. And what about for men? Do you see age-related and or just typical symptoms being different for them?
Men, you see more typical symptoms. There is the left shoulder pain. Many times, men and women will complain of a heaviness or a tightness in their chest. The important thing to remember is to seek attention if you have any sort of pain or symptoms, but also to remember to think about what were you doing when those symptoms started? Were you eating? Were you exercising? Did it get better when you rested? Typically what we've seen with chest pain that is heart in nature is that it doesn't improve with rest. It's not an indigestion thing that is tied to after you have a heavy meal or something.
Yes. Okay. That's also very interesting. So, Kate, what do you see people actually take motion to move toward either ER, seeing a physician, or others? What do you feel like it makes them move the quickest?
So I think those classic symptoms are always going to trigger a higher level of alarm. So again, pain in the jaw, radiating left chest, those pressures. Many patients experience kind of an impending sense of doom. Something is wrong. They will become very diaphoretic or they will sweat and then some pallor. And all of those things typically spur to action of something is really wrong. The more subtle things, shortness of breath, just not feeling right, back pain, that sort of things, may be worth checking out with your physician because there are a lot of warning signs like those that our body will give us before we're actually in a heart attack situation.
That is very interesting and very good to know. And I hope all of you will take that into heart and to make sure that you're actually paying attention to yourself. As someone who suffers from hemiplegic migraines, so that sensation of losing the left side of my body, that's absolutely not something that would send me to the hospital. Now, knowing for years having them to the hospital about my heart as a female. So it's interesting to put into practice what I'm hearing you say that, feeling your body. And I do think you feeling an impending sense of doom has to have something to do with it, right? You are going to know something is extremely different, right? Your body's trying to tell you. So I think that's great to know. Besides exercise, because we know exercise is good for our stress level, our heart, our life in general, just being happier. We've talked a lot about that. But tell us about anything else. Is there a diet situation that is best, or as Americans or global?
So there's a lot of good resources out there about heart health in general and more heart healthy recipes. There's things that we can do to modify the things that we cook at home. The basic stuff with heart health is there's really strong correlation between Mediterranean type diets, so olive oil, fish, lower intake of red meat, that sort of thing. Fresh food is always better. I think in the U.S. these are first world problems, right? We eat a lot of processed foods or things that are quick and we can get our hands on. They're not necessarily the best for our body. Of course, those things happen. I think it's all about moderation and balance.
And to get into our personal world, what about alcohol consumption?
Alcohol consumption is a good thing to ask. There is lots of evidence out there that says a glass of wine, let's say for women or up to 2 for men is maybe even offers some cardiovascular benefit. I don't suggest anyone go out and start drinking, but I don't think that there's any harm in having a drink if that's something that's already part of your
Okay.
lifestyle. Again, moderation and balance.
I agree with that. I just, what I was thinking about as you were telling us that is, since 1921, this has been number one in deaths, but also like I think about Italy, where the most centurions live, and I'm like, well, they drink and they, fabulous, diet. Just thinking through like it over the course of time and history of knowing that heart health is so important. Have you seen that change over time? So I feel like as we've changed our diets for the last 8 decades, 100 years, So how do you think that plays a part, if any?
I absolutely do. There's something to these, some of these countries that have banned some of the things that we put into our bodies on a regular
Yes.
basis. So I do think that there's something to that, and there's lots of good educational resources out on the internet about all kinds of things that are healthier options and better choice options. Again, I think that there's a balance, right? Like I'm going to have that brownie every once in a while, but I
Right.
probably don't need to have it every single night. So I think that there is a good balance of those things. I also think things like work-life balance and stress reduction are a huge part of other cultures that aren't necessarily
True.
part of the American culture. We want to work harder, get more done, be more successful in our roles, which is fantastic, but it also can take a toll on our health.
Right. I mean, 2-hour lunches and month-long vacations, I could get behind.
Could
Okay.
get behind that.
Yeah. And send an email that says, please don't worry about it. I'll
Yeah.
get back with you when I can. So I love that and would be totally okay if that's the direction we go. Is there anything else that we maybe I didn't ask that you'd like to share with us?
I think it's really important. Regular checkups are important. So checking in with your physician, knowing your numbers. It's important to be checking things like your blood pressure. And there's all kinds of, again, resources online. You don't want to check your blood pressure after you've just been in running or in a high stress situation. You want to sit quietly, take it, about 5 minutes after you're at rest. You want to trend those things. Most things in healthcare are not one spot number being out of whack. It's watching things over time. And then again, take any symptoms or anything that you're feeling seriously. Don't write that stuff off. With your heart, any of these things, time to those injury is muscle. And so when we think about it like that, it's just really important. The sooner that we can do things, the better. Small changes can make a huge difference. I know there are people out there still smoking, but please stop smoking.
Please stop
It's
smoking.
so bad for you. Make small changes, taking walks outside, breathing techniques to help, like either like in a meditative state or even just in a high stress moment where I know for me, I carry a lot of stress in my jaw and I will find myself clenched down. If I take 5 minutes and do some focused breathing and really kind of recenter myself, it can help lower those stress levels.
I love that. That's wonderful. Well, personally, I learned a ton today, and I thank you so much for joining us. This is so important, and sharing it with our community and getting the word out there, even if you're not watching the news or any social campaigns. Please get your heart checked, and please let us know how it's going. I'm Nonette Reese, and this is Kate Ruud, and we thank you for joining us. Thanks for joining me on Start a Conversation. I hope today's discussion gave you insight, inspiration, or simply a new perspective on real estate, community, and the stories that connect us. If you enjoyed this episode, please be sure to subscribe and share it with a friend. Until next time, let's keep the conversation going.